This week's question is a more general question, which turns out to be something that does pertain to myeloma. The question is, are statins, drugs which are used to lower the cholesterol, things like Lipitor or Crestor, for example, there are several of these on the market. The question is, are these things that are helpful for myeloma patients or maybe harmful and need to be used with particular caution? Well, the answer for myeloma patients is really a little bit of both. Interestingly enough, what turns out to be the case is that in addition to lowering the blood cholesterol, statins also enhance bone healing or bone growth. And actually, it's known that everyone who takes statins can have some improvement or increase in bone density. And so this is something that can be especially helpful, potentially, for patients with myeloma. And so the first part of the answer here is that actually statins could be helpful for myeloma patients in terms of reducing the risk or complications from bone disease. Unfortunately, there, as of the present time, have not been large formal studies of this in myeloma patients to document the nature and the magnitude of that value. And actually, it would be extremely helpful to have more information on this. But in terms of harm or benefit, there is this benefit. On the side of harm, I think, and this has been very much in the news more broadly recently, these drugs are not without side effects, and that's obviously true for myeloma patients also. There are a number of important drug interactions with these statins, and this is definitely something to talk to your doctor about. You should very carefully review what are all of your medications and are there any possible interactions with the statin drugs. I would draw your attention to a couple of things. One is that statins can interfere with antibiotics, and so, for example, the antibiotic Biaxin is broken down more slowly when you're taking statins, and so you can have reactions because of that. Another interesting thing to be aware of is that you should be extremely cautious taking grapefruit juice if you are taking a statin. Grapefruit juice, the components of grapefruit juice, and now this is different than lemon juice or orange juice. Grapefruit juice has components which can delay the breakdown of statins and actually lead to some liver side effects. So be very cautious taking grapefruit juice if you're taking a statin. And so definite cautions and possible even serious side effects. In the case of myeloma patients, there can be an impact on muscles with muscle pain and tenderness and swelling, which can even end up being confusing with some kind of a myeloma side effect. And so there is no 100% scot-free use of the statins, but there is this possible helpful side benefit. And so the bottom line for me is don't be overly concerned that there's a harm related to the biology of the myeloma or the impact on the treatment itself, but be especially cautious about the side effects, and you absolutely need to talk about it carefully with your doctor.